On a wet night in Yokohama, Japan, the buses some Americans have been waiting for finally arrive.
All right, this is it. We're about to step into the big wide world, so I have to put my mask on and get going.
Bye.
As Cheryl and Paul Molesky bid farewell, others are left to stay. 300 Americans set off from the Diamond Princess cruise liner late at night to fly back to the US.
We're exhausted, but we're on the plane.
A flight like no other, complete with hazmat suits and masks en route to Texas for another 14 days of quarantine, on top of the fortnight they've already had. They leave as the biggest spike in cases on board has been confirmed. 99 people have tested positive, bringing the total to 454. But for British passengers still on board, the question is, when can they get off? The son of a couple on the ship wants to know.
This is my plea. This is my plea.
And is asking the government to help.
I want my mum and dad to wake up in the morning and actually have some information sent to them. I want them to be... They need to be communicated with. No one's actually speaking to them, which is driving them crazy, as if it's like they must be going crazy as it is just being inside that cabin.
The Foreign Office say British citizens could be flown home, and they're looking into a repatriation flight. The Diamond Princess now has the highest number of people with COVID-19 outside of Wuhan. How did this all begin? On the 1st of February, a cruise passenger from Hong Kong tests positive for the COVID-19 virus when he gets off. On the 3rd of February, the Diamond Princess is placed on quarantine and screening on board starts. On the 15th, Americans are told about evacuation plans to get them off the ship. On the 16th, other countries, including Canada, Israel and Australia, announced they're following suit. And on the 19th of Feb, it's expected this is when the end of quarantine will happen. Not all on board want to come off. We spoke to American Matthew Smith, who decided to stay.
We have never gone outside our cabin. No one has ever come in. I don't believe that the food service or service from the crew is likely to have communicated the virus to us, and we do not have contact with anyone out on the balconies. So we believe, anything can happen, but we believe we're sufficiently protected that there's no reason to be afraid of having caught the virus. And even if it somehow happened, we'll just deal with it. Being afraid of it is not going to change anything.
Here in the UK, the government are ramping up their response for passengers arriving from parts of China and Asia. The Holiday Inn near Heathrow is block booked as part of measures to control the spread of the virus. But tonight, the focus is on the Diamond Princess cruise liner, with 2 days of quarantine left. Questions are being asked whether passengers should have been taken off sooner, as different countries grapple with the best way to deal with COVID-19.
Aisha Tull reporting. Well, joining us now is Dr. Natalie McDermott, a specialist in outbreak disease control at King's College London. And let's just stay with the ship for a moment. I mean, why do you think it's been such a disaster? I mean, everybody thought, oh, what a clever idea. But in fact, it's been a method of giving more people the disease.
Yeah, I think it is a bit of a conundrum, really, because it should have worked. So I think there probably needs to be an investigation once everyone's off the ship to identify what happened. Did quarantine measures fail? So was it not being implemented properly? Was there some kind of environmental source on the ship that we need to know about that helped in the transmission? Or is this really just that actually a lot of people were exposed a lot earlier than we thought, before quarantine started, and they're just showing symptoms over a gradual period of time?
But I mean, the cruise ship is being isolated, obviously. But at the same time, we get this information from here in Britain that schools should sort of carry on if a suspect suddenly comes to school and they're worried about the worst. How does that work?
Yeah, so the schools are being advised if there's a suspect case. So that's someone who hasn't necessarily tested positive for the virus yet. They just have symptoms that could meet with the virus. But we know that the symptoms of this virus in the early stages are very similar to any other cough or cold or flu virus. So it's very likely that the child probably isn't infected. And I think at the moment, they're trying to encourage children to go to school because we don't have any person-to-person transmission of the coronavirus here in the UK at the moment.
That's very interesting, because these plans to provide hotel rooms, for example, for travellers showing symptoms at Heathrow, how does that work? I mean, if you're showing symptoms at school but you haven't got it, what's the difference?
My understanding of the hotel rooms is essentially contingency planning. So if there were a lot of people coming off a flight or several flights in one day who were thought to be unwell in some way that were identified, this is somewhere that they can be placed whilst they're awaiting test results. Now, in the UK...
But that sounds a little bit like the cruise liner. I mean...
Well, yes, but they're coming from places that are known to be affected. And the cruise liner is known at the moment to have had confirmed cases on board. In the UK at the moment, we only have one current confirmed case who is isolated in a hospital. So what Public Health England are advising is children can still go to school. We shouldn't be holding them back because of concerns. But if there is a confirmed case in a school, then they will take action and discuss with the head teacher of the school what measures need to be in place.
And briefly, teachers are fine, providing it's only suspects and not confirmed. And workers at Heathrow are OK, providing the same.
Yes, so essentially the strategy is always to do a risk assessment. And the risk assessment for someone in the UK who hasn't travelled at the moment would be very low that their symptoms are of coronavirus, especially if there's no known contact. At Heathrow, the workers are safe, but obviously they will be contacted by Public Health England if they're known to have contact with someone who tests positive.
Dr. Natalie McDermott, thank you very much indeed for joining us.